When bleeding is severe, it can be dramatic and distressing. If someone's bleeding isn't controlled quickly, they may develop a life-threatening condition called shock, and they may lose consciousness. If someone's bleeding from the mouth or nose, they may find it difficult to breathe, so keep a close eye on them in case they become unconscious. If someone is bleeding severely, protect yourself by wearing gloves. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it in and apply pressure either side of it with a pad until the sterile dressing is available. If there's no object in the wound, we can apply a sterile dressing if we have one to hand, keeping the injured part elevated. We're going to cover the wound with the pad. Can you hold that for me? Making sure we cover the edges, top and bottom, and place the remainder over the open wound. Is that too tight for you?
That's fine.
Can I have that? It's not too tight. Okay. Check circulation for 5 seconds by depressing the nail beds, releasing. If the color doesn't return in 2 seconds, you might need to loosen the dressing. If blood comes through your first dressing, apply a second one directly over the first. Get out for me. We're going to have another look. If blood comes through both dressings, we're going to take both off and start all over again. Once you've managed to control the bleed, we can place the hand at rest. We're going to check breathing, pulse, levels of response. We can cover her over, keeping the legs elevated to treat for shock. So remember, when treating severe bleeding, wear gloves. Remove any clothing from the wound. Check for objects, but do not remove it and apply pressure either side of it. If there's no object in the wound, use a dressing or a pad and apply pressure. Raise and support the injured area. Treat them for shock and call for an ambulance. Apply another dressing if you need to, and then support the injured area in a raised position. And that's how you treat severe bleeding.